For you this morning, doctors and health policy experts gathered at the State House yesterday to talk about challenges that they are seeing in our kids' health right now. Brenda was at that event. And Brenda, what kinds of issues are our health leaders seeing right now?
Yeah, Maggie. Well, health policy experts say that the number of children without health coverage is still below pre-pandemic levels, which is really concerning. So the group Idaho Kids Covered organized yesterday's event to call on Idaho state leaders to help address the growing need for children's health coverage. They say it's about making sure that our state's children are getting the help that they need when they need it. The number of Idaho children enrolled in health care coverage is low, so the group Idaho Kids Covered wants to bring awareness to the need.
We also have about 24,000 kids who are uninsured in the state.
That means some Idaho children are not being seen for annual checkups.
After around 2 years of, living in this new way, we've started to notice immunizations, child wellness visits. Kids are falling behind in key areas, and it's time for us to help them catch up and advocate for solutions to ensure that they're getting access to the care that they need.
The Gem State has also experienced a healthcare provider shortage. Idaho ranked last in the nation for pediatricians per 100,000 children, and over the last couple of years, routine child vaccines have also decreased by 12 million doses.
Well, what I'd say that's concerning is that we're just not seeing a return to baseline from before the pandemic. And so I think in the early months of the pandemic, the interruption was obviously greater, but we still haven't seen a return to the mean.
Idaho Kids Covered held their Checkup on Kids event at the State House on Wednesday to urge Idaho lawmakers to take action and help increase funding to address this issue.
We're happy to see legislation currently moving through that is investing money in behavioral health. There's behavioral health investment that could result in several new community health clinics and crisis centers. And so we really hope to see this legislation pass and signed into law by the governor, because we know the behavioral health system desperately needs it right now.
And although these numbers are concerning for Idaho Kids Covered, Idaho family doctor Megan Houghton says they are seeing signs of hope in some Treasure Valley clinics.
They still usually have at least 1 or 2 kids that are there for mental health reasons, but it's less than it was a couple months ago when I was on that service. So that's encouraging.
And if passed, Senate Bill 1384 will provide more funds to help address mental and primary health in the Gem State. This includes children's mental health. And for resources on how to get your child enrolled in health coverage, visit our website at ktvb.com.
Such an important topic, Brenda. I'm glad you're addressing it. Thank you for bringing us that story this morning.